In this week's muscle breakdown, we're covering the sciatic nerve getting entrapped at the deep muscles in the hip rotators, specifically showing how to effectively find, fix, and reduce scar tissue around the nerve. So everybody, Dr. Matt Maggio here, creator of the Peak Method and the founder of the Soft Tissue Revolution, where we teach massage therapists on the verge of burnout, a new treatment method that allows them to cut their session times in half and easily double their income. So back at it for muscle breakdown. In last week's video, I covered the sciatic nerve getting entrapped in the muscles deep in the external hip rotators, gave some spoiler alerts that it's actually not the piriformis, showed you some functional based tests on how to find if this is actually a problem, how to palpate correctly. If you haven't watched that yet, I'll link it up in the show notes as well, so you can go back and watch that. I've shared this a lot before, but there are over 256 different places in the body where nerves can get caught. I said it presents with numbness, aching, burning, and tension. So what happens over time is we spend too much time sitting on our butts, not moving how we should, or maybe overworking, doing too much exercise, all sorts of things. Those muscles get overworked. When those muscles get overworked, they don't get enough blood flow, they don't get enough oxygen, and they develop scar tissue. Scar tissue starts to lay down and it starts to build up over time. It's like glue that gets inside there. And over time, that scar tissue gets bigger and bigger and bigger. And eventually what it does is it gets glued and stuck in the nerve and creates one of those entrapments. So basically, it creates like a space occupying lesion and spreads out as you go. So when you're treating these nerve entrapments or treating any type of muscle, the key is actually getting proper tissue slide on there. You know, I've done a lot of training in like myofascial release, active release technique, all that stuff. And what I end up finding is that they don't let that tissue slide enough. In order to break down scar tissue in a muscle around a nerve, it doesn't need a lot of force. It needs proper depth, then tension, and about 6.8 pounds of force in the right direction. What I find is that so many therapists are way too compressive, and then that tissue gets stuck. It hurts like hell, so you think the client is actually getting something out of that, and all you're doing is jamming on an area that really hurts. So what we teach in the Peak Method is first, as you saw in the earlier videos, is being able to find and fix it based off a thorough history, a thorough evaluation, and then palpating in there. And then when we get in there, we're able to see with our hands and bowing away where that nerve gets stuck. And usually where that nerve gets stuck is right where that scar tissue is. So I always teach my practitioners that learn from me to go slower so they can go faster. Sounds weird, but go slower so you can go faster. And what we teach is proper depth, then tension. I always say it's a lot better to do 3 awesome passes on the tissue instead of 10 shitty ones in there. Sorry for my bad language, but I like to swear every once in a while. So what I want to include this week in the training is a demonstration of me showing how we treat scar tissue around the sciatic nerve using manual scar tissue treatment. So check it out. Now we're going to get into the sciatic nerve treatment. The client position is very important. You want them to be stacked up to the edge of the table, have that shin tucked nice and parallel. And then essentially what we're going to do is bring this leg over nice and straight because it's going to create tension on that nerve and it's going to sit right against the table. Now the motion for the client is they're going to start, once we apply depth and tension, they're going to start by moving their leg just like that. They're going to reach behind with the hand and pull it just like that. And that's going to create that motion and that tension. Now the key is getting on that and finding the palpation. You've watched the video, now you know where to go. Now, the key here is your body position where you line up. So once you're in here and you find the area, you have the trochanter, you have the back of the trochanter, and then you sink into that space. This space up here is hip capsule. This back here is sciatic nerve. Once you find that, your hand is going to be nice and flat. See how that's flat in there? You don't want to be tented, you don't want to be grabby with that. Then the next thing you're going to do is you're going to back that up with that opposite thumb. What you're going to do next is back that up with the opposite part here. That's going to help you get your depth. So once you find that area, what you're going to do is you're going to be right over top of it. Your thumb is going to be in just like that, and you want to be up on your toes, arms nice and straight, and you're going to lean in just like that. And then you're going to get some more depth by pushing with this opposite arm. And then your tension is going to be that slow body lean. And then the client is going to start to go through that motion
and start to move that. And you're just going to keep your sternum right over the top. And sometimes when they're really having some trouble moving that, you're going to sink in, push in like that, tension, go ahead. And you might have a client that has some trouble with that. What you're going to do is readjust, and you're going to get the rest of that motion in there to open up, just like that. Now the key here is your mechanics and your body position. So you want to be up on your toes, and you want to have your arm nice and straight, and you're going to sink in just like that. Your depth is going to be that push here, and your tension is going to be that lean away. And what you'll see is when you're doing that, you're going to kind of pivot on your feet and pivot on your toes. That's going to help you keep your sternum over top. Because if you keep your sternum over top, it's going to allow you to keep the right vector and make that a more effective treatment as well. So the key is setting up just like we've shown you in the warm-up. You're going to set up in through here, on your toes just like that. Sink in, press, tension, go ahead. Client moves, and sometimes you got to give a little extra help, and it's going to be a gentle. You're not going to force it. You're going to take it just past parallel of the hip here, and you're going to go nice and slow, because if you're too quick, it's not going to feel great for the client. It's going to pull that nerve really tight, and you're not going to get an effective treatment.
Big problem that I end up seeing with so many massage therapists are they're just beating the hell out of their body. You know, they want to go harder, 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 deep tissue, slam on things and everything like that. And what it's doing is it's messing up your body. It's putting you in a bad place. And it's not really creating an effective treatment for the client. You know, we get so stuck in this idea of like, it hurts like hell, it must be doing something. No, it doesn't. I always say the treatment should be like a hurts, but good, but nothing too excruciating. And you see, when I'm setting up for my treatments, I'm very slow. I'm very deliberate. I'm using my body. I'm using leverage. I'm not beating up my hands, my elbows, my wrists. I'm using my strength and my power to generate that force. That's how I always say, work smarter, not harder. And what you should see when you're doing the right type of treatment is that tension and that pressure should ramp up as you go. It shouldn't be like phew, right away. It should take some time to build up as you go. And that happens when you actually take the time to palpate it, to find it, and then get in there and actually treat it with your hands. You know, so many people, and especially therapists, we're just so quick to want to get our hands on it. It's like, slow the hell down, take some time, do some measurements, figure out what's going on. So many practitioners spend so much time doing what I call a shotgun approach. They just treat a bunch of shit and see what happens. We're more of what's called a sniper approach. We line it up, we get it, we do it right, and it's going to be able to help effectively fix it for good. It's all about long-lasting improvements in the treatment, which will improve pain, improve function, and get people better. So that's all I got for this week's muscle breakdown. If you like it, you know, share it with somebody, give us a comment, a like, a share. If you got any specific muscles or areas or injuries you want me to cover, send me a message. Go grab our free training. We put that together. It's been really awesome. It goes into our whole system, shows some treatment, palpation, taking histories, understanding different types of problems. It's something that I worked really hard on, and I want to share it with the rest of you so you can get a better idea and become a better version of yourself and help more people. Appreciate you guys watching, and I'll see you on the next one. Bye.